mastectomy for your breast cancer, we will teach you all about it. When you're diagnosed with breast cancer, so many think, gosh, I don't want to go through this again in the future with a new breast cancer. So why not consider having a bilateral mastectomy for my own peace of mind? For some, this is a simple decision, and others, an agonizingly difficult one. I will walk you through the medical ups and downs of a bilateral mastectomy for breast cancer on one side. But ultimately, this is a somewhat medical, but a deeply personal decision that you will have to make. In this lesson, I'm going to tell you what exactly a bilateral or double mastectomy is, what's involved with this, and some of the plastic surgical reconstruction options. I'm going to go over situations where your breast surgeon may recommend you have a bilateral mastectomy. I'm also going to review what is your risk of developing a completely new breast cancer in the other breast if you have a mastectomy on one side. I'm going to go over why some choose and why we sort of recommend against, in many ways, a bilateral mastectomy for breast cancer on one side. I'm going to go over the controversies of the fact that more and more women are choosing bilateral mastectomies than they have in the past. And ultimately, it is your decision to decide what to do with your body to treat your breast cancer. So let's get started. So what is a bilateral mastectomy? Well, it's obvious that a mastectomy is removing the breast tissue and keeping the skin. So the tissue that's underneath the breast is really, in essence, a mastectomy. And in this case, we're talking about removing both breasts' tissue. So let me explain. The simplest way of doing a mastectomy is removing the breast tissue without reconstruction and removing the nipple and the areola and removing the breast, and that leaves things flat on the chest with an incision across both breasts on the chest. Simple mastectomy. A mastectomy with reconstruction typically in today's world involves a skin-sparing mastectomy or a nipple-sparing mastectomy. That's where we preserve more breast skin for a skin-sparing mastectomy. And a nipple-sparing mastectomy, we're preserving all of the skin of the breast, including the skin of the nipple and the areola, and then reconstruct underneath with a plastic surgeon who works as a team with your breast surgeon and begins that reconstruction the day you have your mastectomy. And then oftentimes there are subsequent surgeries that follow to complete the breast reconstruction. A majority of patients choose to have breast reconstruction, but it's a personal choice whether they're interested in pursuing that. Now, our cosmetic outcomes are dramatically better now than they were a decade or two ago. But it is important to note that a mastectomy, a bilateral mastectomy, with or without reconstruction, is a significant surgery. And it can result in complications. It can result in sensation loss over the area of the breast. It can oftentimes need further surgery in the future if you have reconstruction to revise your reconstruction. So we don't want to minimize the significance of a bilateral mastectomy when compared with a mastectomy on one side, or when compared with the choice of simply having a lumpectomy and radiation therapy for an early stage breast cancer. What are the situations that your breast surgeon may recommend that you have bilateral mastectomies? Well, if you have breast cancer in both breasts when you present to your surgeon to get treatment, there's some situations that you may benefit best from a bilateral mastectomy. But sometimes if you have a small breast cancer in each breast, you can still have a lumpectomy, preserve both breasts, but you will likely need radiation to both breasts. It's also important to note that if you present with breast cancer in both breasts, you are likely an increased risk for developing a new breast cancer if you preserve your breast, because that's such a red flag for increased risk when you present at the same time with breast cancer in both breasts. If you carry the breast cancer gene, the BRCA mutation. If you're diagnosed with this, either came to see your surgeon already knowing that you carry the breast cancer gene, but more commonly, you present to your breast surgeon and you have red flags for the BRCA mutation, and they offer you genetic testing before surgery and you're positive, then you have a 50 to 60% lifetime risk if you have a lumpectomy on one side for your breast cancer. You have a 50 to 60% risk of developing a completely new breast cancer in the future because your breast tissue is at such an increased risk for developing a new breast cancer. And that's a situation where a lot of women choose to have bilateral mastectomies. If you have a super strong family history of breast cancer, I mean, everybody in your family has breast cancer. And even if you are BRCA negative and no one else in your family has the breast cancer gene, that's a situation that some women choose to, in concert with their surgeon, to have bilateral mastectomies. That's a really small subset, but it's one that sometimes we're really worried that something else is going on in your family we just don't know about quite yet. If you're younger than 30 or 35, a lot of times you and your surgeon will talk about the benefits of a bilateral mastectomy because there's an increased chance of something growing back in the breast if you have a lumpectomy and radiation if you are younger than 35 versus if you were diagnosed at 50 or 60 or 70. Also, if you, unfortunately, when you were younger, in your late teens, early 20s, had radiation to your chest, generally for lymphoma in the past, because that radiation went through your breast at such a young age, it imparts a very increased risk of developing a new breast cancer and causing breast cancer as you get older. So if you have a breast cancer and you had radiation to your chest for cancer years ago, then that's a situation where you would consider having a bilateral mastectomy. All of these situations are a minority of the reasons, actually, why women choose to have bilateral mastectomies. Most do it for personal reasons, and we'll cover that shortly. So what is my percentage risk of developing an entirely new breast cancer in my lifetime if I keep my other breast? So let me walk you through this. If you're choosing to have a mastectomy on one side because you need to have it, or you've chosen to have a mastectomy for your breast cancer, let's pivot and think about the other breast. What is my risk of getting a cancer, and what is the ultimate threat to me of keeping that breast? Because you kind of want to know how much of a threat it is to you, because it's a big part of one of the decision factors is why you might choose a bilateral mastectomy. So let's say you are 45 and you have no other risk factors. You present with a breast cancer. You're choosing to have a mastectomy on one side, or you need it because of the factors that are found in that breast cancer. What's your risk of the breast cancer on the other side developing? What's your lifetime risk of dying from that? So if you think about all women who develop breast cancer, about 8% of all women develop a breast cancer in their lifetime. But if you've been diagnosed with breast cancer, your risk is a little higher because you've had it once and maybe there are things going on in your body we don't know about. So let's raise that lifetime risk for you from 8 to 12%. So that's 12% for both breasts. And now we're cutting that in half. I'm going to do a little math here. Cutting 12 in half, so 6% lifetime risk of developing a breast cancer in the breast that you leave behind. Let's pretend that we've had a mastectomy on the right side. So if you have a 6% lifetime risk in the future of developing a new breast cancer, and we actually find one, we cure 90% of all breast cancers. So the risk statistically of dying from a breast cancer on the other side, if you've had a mastectomy on one side, is 10% of 6%, which leaves you at 0.6% lifetime risk of dying of a breast cancer from the other breast. So it's a very low risk. That does not minimize the experience of going through